The world is different this year than it was last year. Life has changed in terrifying ways, seemingly overnight. Theaters, schools, churches, all closed until further notice. You're only able to go get groceries at the town shop, and supplies always seem to be running low. You're barely able to make it by with household finances, scraping the pennies together to make necessary purchases. And just when you think things are as bad as they can be, you come home and you see your spouse has the same color across their face as the white sheets on the bed. In that moment, you realize things just got a lot worse. This is reality across the globe, a global pandemic, and the world is at a standstill. This sounds like the year 2020, but it's not. This is the situation the world faced 100 years prior. This is the influenza pandemic of 1918, otherwise known as the Spanish flu. A pandemic that would terrorize the globe from 1918 to 1920, infect over 500 million people across the globe, and leave a death toll of over 50 million people. The social fabric across America was strained to the max. Neighbors turning on each other. Government crackdowns on practices that were thought to contribute to the spread, and over 675,000 men, women, and children succumbed to the disease. Hello, listeners, and welcome to the Mercenary Podcast. It's your host, Nurse Rick, and today's episode is going to be a breakdown of the flu pandemic of 1918, going all the way through to the very first publicly approved flu vaccine. But before we get too far into today's episode, if you're listening on YouTube or Rumble, drop a like on this video and share it with friends and family. It greatly helps the channel. Also, be sure to subscribe so you never miss an upload. For all other platforms, make sure you follow so you get notifications when new episodes drop. Lastly, head over to the Mercenary shop and pick up some merch and surprise that healthcare worker in your life with some new threads. Now, let's jump into today's episode. So, it's unclear where that first case of the flu broke out. There is no definite patient zero that has ever been pinpointed. Several countries at the time had patients suffering and dying due to flu-like symptoms. Also, there was a big war going on that you might have heard of called World War I. That led to death tolls in the millions, with soldiers dying from battlefield injuries and illnesses, some of which resembling flu-like symptoms. It's understandable why scientists and historians can't pinpoint where the strain of flu exactly started. The most prevalent theory is that it started at a U.S. military base named Fort Riley, where 1,000 soldiers became infected with a respiratory illness with flu-like symptoms. Out of the 1,000 soldiers who became ill, 40 of them would die due to that illness. The rest recovered from the symptoms and then deployed over to the trenches of World War I. 84,000 total U.S. troops were sent to Europe in that first wave, and this is where that fuel and the fire ultimately met and set the world ablaze. This virus left no corner of the globe untouched. Island nations that felt relatively safe would eventually, somehow, fall victim to this invisible killer. During the war, both sides of the trenches were massively afflicted with ill and wounded men. It turned Europe into a depressing hellscape of death and despair that the world had never seen, and thanks to politics, the world wasn't hearing about it either. This is how the name, the Spanish flu, came to be. So, the Europeans that were fighting on both sides of the trenches didn't want to appear weakened to the opposing side. So, leadership in their infinite wisdom, instead of saying, hey, there's some sort of terrible respiratory flu going around that's killing as many soldiers as bombs and bullets are, decided it would be much more strategic to engage in what I'll call tactical death toll omissions, which is another way of saying lying to absolutely everyone. Enter Spanish King Alfonso XIII, and the finger pointing begins. With Spain being a completely neutral country during the war and not being subjected to news blackouts for tactical purposes, became the first country to start widely reporting on this new illness that was killing the young and the old at the rate of hundreds to thousands a day. Following the rules of thou who smelt it, dealt it, the rest of the world decided Spain, therefore, was where it started, forever making this pandemic known as the Spanish flu. By the time the war was over and the attempt at official reports were made, was clear that the flu was devastating for everyone involved. The Germans, they probably underreported the flu deaths at 14,000 troops. The French reported 30,000 died of flu. And again, probably underreported. The Russians reported 100,000 deaths. America reported 45,000 flu deaths. British reporting was pretty unclear, but it stands to reason it was probably pretty comparable to other countries. And with reporting not being the most accurate due to fog of war, political strategic reasons for skewing numbers, and multifactorial mortality, not necessarily declaring flu as the cause of death, it's impossible to know exactly how many soldiers died of the flu. Estimates are varying, but for this episode, we're going to go with the good old Wikipedia estimate of 2 million troops around the world. The estimated death toll of military personnel throughout the 4-year-long war was 9 to 11 million. That means if we do some mathing, that in 2 years of fighting, 18 to 20% of casualties occurred and weren't even deaths on the battlefield due to bombs and bullets. While World War I was still underway, America began to feel the dark embrace of the pandemic back at home. To make matters worse, we had a shortage of health workers and doctors. Why? Because there was a war going on, and guess where most of them went? And now, we can dive into some good old historical controversies back here at home. So, March 18th, 1918, possibly the first case of the Spanish flu. This is toward the end of flu season, however, and though it can still spread, the climate throughout the US at that time probably wasn't very favorable to viruses. Heat, UV rays, and other factors can definitely slow the spread down. That being said, people were getting very sick very quickly. Doctors at the time likely attributed it to a severe form of the common cold and kept the ball rolling because, well, it's summertime and obviously they got shit to do. However, that was soon to change. In September of 1918, when flu season drastically ramped up and reared its deadly, ugly head. There is no one place that I can pinpoint as the epicenter of the spread. Ultimately, it seems like it was kind of everywhere across the country in low numbers. Looking at archives, however, we can pinpoint which areas were slammed harder than others. Metropolitan areas, New York, Philadelphia, San Francisco, Chicago, all of them had turned into epicenters of sick and dying citizens, overcrowded hospitals, sanatoriums, and community centers. Fear is an understatement when describing the feelings of people living through this time in history. Fear is what led to some of the worst mistakes during the pandemic, because scared leaders were making decisions that weren't always the best ones. For example, Chicago Health Commissioner Dr. John Dill Robertson declared on September 16th that influenza was well under control in the city, until 14 days later when he completely changed his stance and ordered the Cook County Hospital to isolate all cases. The day after that, realized that would be impossible, and he put out an announcement to the public. Every victim of the disease is commanded to go to home and stay there. No visitors are to be allowed. Basically translating to, we prefer you die at home. Dr. Robertson also mandated police to stop all persistent sneezers and coughers who did not cover their face with a handkerchief. Anyone that gave officers a difficult time with compliance would be arrested. Surprisingly, Chicago did not put in place any lockdown orders on schools, churches, or gathering places, so long as people cover their faces with a covering when coughing or sneezing. Achoo! That would change again a few days later as more panic set in. In Chicago, officials formed an influenza advisory committee. This committee would soon pass resolutions that would sweep away freedoms across the city, placing bans on activities such as dancing in clubs and funerals across Illinois. Days after that, officials handed down something they were reluctant to do. They shut down all the shit. Church, theaters, restaurants, you name it, they closed it. Weirdly enough, they did let certain gatherings they subjectively deemed low risk to remain operational. Saloons, pool rooms, bowling alleys, and children's schools were all allowed to remain open. By November, the flu seemed to be on the decline, and health officials, including Dr. Robertson, started to let up on those restrictions. However, the public was not pleased with his and other officials' decisions dictating their lives and their businesses. So, as restrictions loosened, the papers of the time would jest about Robertson with statements such as, "By virtue of the gracious order of Dr. Robinson," or "His Highness," or "His Eminence." Fitting. Dr. Robertson, after the pandemic ended in Chicago, would go on to push for Dr. Robertson, after the pandemic ended in Chicago, would go on to push for legislation in Illinois to bolster the number of nurses licensed in the state. This would be of vital importance during the next epidemic a decade later, during the tuberculosis outbreak. These nurses would go on to volunteer in sanatoriums across the state. Like every other major city in the US, Albany wasn't expecting what was coming. Without warning, the invisible killer moved in rapidly and without mercy. Like Dr. Robertson in Chicago, Dr. Arthur Sauter drastically underplayed the coming wave of infections that he was about to manage. He went so far as to not even believe Albany had that many cases, even though surrounding cities were reporting hundreds or thousands of cases a day to state authorities. Weeks after the pandemic had started, Dr. Sauter went so far as to publish a report in the paper stating the city had been unusually fortunate in terms of their rates of reported illness. Exactly 2 days later, he was in full panic at report that Albany had 6,000 cases of influenza and almost immediately called for drastic lockdown measures. Sauter and his officials went as far as to charge fines and misdemeanors to misdemeanors. Sauter and his officials went as far as to charge fines to citizens caught sneezing or coughing without covering their mouths. A fine of $500, the equivalent of $10,000 today. Almost as quickly as it started, it seemed to have ended. After just 2 weeks of lockdowns in Albany, officials started to slowly remove those bans. Cases appeared to have stayed stable and decreasing. Hospitals started to empty and care resumed at a normal rate. The aftermath, however, would leave thousands of children down a parent and leave some orphaned entirely. Public, private, and nonprofit organizations would soon go to work helping those that were most affected. Now, New York was a different story than Albany due to its density and its massive population. Due to previous run-ins with contagious illness and being a port city, officials had some experience in isolating and quarantining individuals and monitoring case numbers. However, what was to come was about to be overwhelming. Dr. Royal Copeland was at the helm of New York response and put quarantines in effect immediately. But within weeks of August 11th, 1918, after a boat came into port with confirmed cases of influenza, he had to put the entire port of New York on lockdown and quarantine in an attempt to stop the spread. Copeland, being the leader he was, attempted to quell public worry, stating no need for alarm. Copeland went to work meeting with shop owners and business leaders to give recommendations for preventing the spread without a widespread lockdown. One of his colleagues, Dr. William Park, went to work trying to isolate the causative agent of the disease and develop a vaccine that would protect the public, a feat that would be successful 2 decades later. New York's health officials attempted to quell the spread as best they could. And for my review of documented data trends from the University of Michigan's Digital Encyclopedia, probably did one of the best jobs out of the whole nation when it came to a steady increase and a return to zero. Compared to other coastal cities and metropolitan areas, New York City was by far one of the best handled by leadership. No intrusive jail time, school nurses examining children before the start of classes every day and sending home the ill, managing hospital beds and resources, deploying volunteer nurses and third-year medical students door to door of citizens infected with influenza to help with care. By the end of November, Copeland's leadership and efforts kept the deaths down to 20,000 New Yorkers in a city of 5.6 million people. Our nation's capital had a different approach to the response. Under the leadership of Dr. W.C. Fowler and Surgeon General Rupert Blue, Washington would be the center of many missteps that would lead to it being one of the worst hit cities in the nation. In late September 1918, Fowler did not believe that an epidemic was on the horizon until the case numbers and deaths started trickling across his desk. Within days of the first reports of death, on October 2nd, Fowler quickly ordered all schools in the area to be closed. Public and private schools all shut their doors from that day until the end of the pandemic. On October 3rd, essentially all public gathering places were placed on lockdown, curtailing all social spaces. Children were barred from using city playgrounds, funerals weren't allowed, and court hearings were all postponed. Army medical officers were ordered to assist civilian physicians in treating and reporting new cases to the state. Several emergency hospitals were opened and staffed with civilian and military healthcare workers alike. As quickly as those hospitals opened, however, it seemed they were overrun. The cases and the death toll continued to climb through the last week of October and then seemed to be on the decline. Fowler was under immense pressure to loosen restrictions, but refused for days to cave to pressure. Then, in the coming days, he finally caved to the public and political pressure and lifted the bans on October 29th and fully reopened by November 4th. To the shock and horror of leadership, however, towards the end of November, cases were back on the rise. This put Fowler in a very precarious position, stuck between writing out the cases or issuing further lockdowns. Fowler was on the side of further lockdowns. The committee, however, had other opinions, and the consensus after the meetings were to keep the city and economy open and see how the day-to-day played out. Sure enough, a smaller spike in cases happened, but fizzled out over the coming weeks. Ultimately, Washington, D.C. had one of the highest death rates per 100,000 residents at 608 per 100,000, losing a total of almost 2,900 lives. In the name of tying things in together, we need to talk about the national guidelines that possibly made the pandemic even more deadly, what I call the aspirin debacle. A German scientist in 1892 named Richard Pfeiffer made a mistaken discovery while examining the mucous membranes of patients who had died to the flu in 1890. He discovered a bacteria in the sputum of all the corpses that was universally found among all of them, and the discovery was huge. To date, there is no understanding of what caused influenza, so this bacteria had to be the culprit, right? Wrong. The scientific community, however, was quick to accept this as the cause of the flu that had plagued us for thousands of years. The problem was, this bacteria wasn't the only culprit. Technology and imaging hadn't advanced far enough along to be able to view the true culprit, viruses. The bacteria, dubbed Pfeiffer's bacillus, was assumed to be the culprit of the 1918 influenza strain as well. Leaders were so certain, the U.S. Surgeon General we mentioned just a minute ago, Rupert Blue, issued nationwide guidelines titled Infectious Agent, the Bacillus of Pfeiffer. This meant that from the start, efforts to treat this pandemic were going to be the wrong ones, leading us now to aspirin. Guidelines around the use of aspirin had been recommended by the nation's highest-ranking health officials. Nobody claimed that aspirin was a cure. It surely wasn't. However, it did do something that we still focus on today in our practices, called symptom management, alleviating the suffering of the ill and giving the body a chance to rest and heal. The problem arose with pharmacology and correct dosing of the aspirin. Today, it's not recommended to take more than 81 milligrams a day for the maintenance of coronary artery disease, or 325 milligrams for acute heart attack symptoms. Nobody understood that back then, and regulation of medications were nowhere near as stringent as they are today. That being said, health authority recommended up to 30 grams a day, which is an incredibly toxic dose. You pair a toxic dose of aspirin with a highly virulent and deadly strain of flu, and you have a recipe for disaster. Essentially, you take that initial September/October spike of flu cases and factor in not only the flu, but aspirin overdoses, and things become murky really quickly on what was the deadliest part of the pandemic, the virus or bad treatment recommendations. In 1933, across the pond, British researchers Wilson Smith, C.H. Andrews, and P.P. Laidlaw discovered the cause of the 1918 flu pandemic. Not a bacteria, but a virus. PP Laidlaw, what a name. Ayo PP! 15 years after the most deadly pandemic in modern history, science was finally able to mount a response that would save millions of lives. British and American military scientists, after years, were finally able to isolate the virus, put it in a serum, and start testing for its effectiveness. This, however, was before the FDA was as prevalent as it is today. They did do safety tests throughout the 30s to test for the safety and efficacy of the vaccine. How? By testing it on enlisted soldiers first. Historically, soldiers were always the first people to be turned into guinea pigs for the betterment of humanity. During research, scientists discovered two types of influenza viruses, types A and types B, and were able to put both of them in a double-duty dose of serum to fully protect from both of them. By 1945, it was approved for use among the US population. Then, in 1947, scientists and health officials noticed the vaccine wasn't effective against the flu that season, and that puzzled them. But, armed with this observation, they began to study the change, noting that the rapid mutations made it harder and harder to track and treat. So, the World Health Organization created a monitoring organization named the Worldwide Influenza Center and the Global Influenza Surveillance and Response System to be able to track the mutation of viruses around the world and be able to constantly update vaccines with the most recent strains or the most likely viruses to circulate. This practice and these organizations remain in place today and are constantly at work trying to protect the public. Over 100 years ago, a pandemic terrorized the globe, infected over 500 million people across the globe, and left a death toll of over 50 million people. From the battlefields of Europe to the factories back home, no person was out of reach of this fatal foe. At home, over 675,000 men, women, and children succumbed to the disease. Through this tragedy, the fighting spirit of humanity never let up. We made it through to the other side, and our perseverance led to some of the most groundbreaking discoveries in modern medical history. We learned and documented differences between steps that worked to improve or worsen public well-being and health outcomes. It's easy to see how leadership during these times of crisis altered the outcome and death tolls of the cities we covered. A new science of virology was born. New treatments to curb the harsh diseases that have plagued us for thousands of years were created. And new institutions around the world were built to monitor and respond to new threats. Well, that does it for today's episode of the Mercenary Podcast. If you enjoyed today's healthcare history topic, be sure to drop a like on this video and subscribe to the channel. If you're listening on your favorite podcast platform, be sure to share this episode with friends so they can learn some things about some healthcare history that will surely make them sound smarter around their healthcare friends. Head on over to the merch shop to support and help grow the channel. As always, everyone take care, stay healthy, get your flu shot, and I'll catch y'all in the next one.